Okay, so today's topic that we're going to study is a very small topic, that is PT, that is prothrombin time, and INI, that is International Normalized Ratio. So what is PT? What is prothrombin time? Okay, so how do we do it? So whenever the coagulation factors get activated, you have to understand that whenever we have injured tissue factor, so we have damaged tissue factor which comes out. This damaged tissue factor will actually change factor 7 into 7A. Okay, so that activation will occur with the help of tissue factor. This 7A will basically what does it do is it will activate factor 10 into 10A. Now, once it activates 10 into 10A in the presence of factor 5, 10A will convert prothrombin to thrombin. So this will convert prothrombin to thrombin. So it converts prothrombin to thrombin, this thrombin will convert fibrinogen into fibrin. It will convert fibrinogen to fibrin. And this fibrin that is formed is your clot. So this pathway, whenever you want to check this pathway, that means you take a test tube, and in the test tube you add tissue factor and you check for the formation of clot. Okay, as soon as you add tissue factor, the time taken for the clot formation as soon as you add tissue factor is called as prothrombin time. So what is this called? Prothrombin time. So as soon as you add a tissue factor and you look for the formation of clot and how much time it takes is called prothrombin time. So this is approximately 10 to 12 seconds. Seconds, that is what you have to remember. And this is very small. Seconds is very small. It's tick, 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 gone. So that is why we have to see it always with the control. Anything which is more than 2 seconds, the control is called as abnormal PT. Anything which is more than 2 seconds, the control is called as abnormal PT. And the tissue factor that we add from outside is called as thromboplastin. What is this called as? Thromboplastin. So when they started doing this test, they used to use human brain thromboplastin. That is, they used to take a human brain, they used to mince it, and what came out from that was a tissue factor. So they started using human brain. So when they use human brain, okay, so this thromboplastin was the best thromboplastin. Okay. But what happens with time, a lot of pharmaceutical companies propped up and they said, why to use human brain? Okay, so why to use human brain? Let us use rat brain or let us use rabbit brain. Okay, so let's use these rat or rabbit thromboplastin. So why should I use human brain thromboplastin? So they started using rat or rabbit brain thromboplastin. Now, what happened was now the PT started varying. So one lab used to give 12 seconds, the other lab used to give 15 seconds. And now everybody knows that anything which is more than 2 seconds more than the control was considered as abnormal. So there was a lot of havoc in the market. So WHO came up with a ratio which came to be very popularly called as INR. So they said, let's report PT as INR, that is International Normalized Ratio. What was that? So they said, okay, let's take PT of the test by PT of the control and let's raise it to the power of ISI. Okay, so that is International Standardized Index. So they said, whenever you are using human brain thromboplastin, that's equivalent to WHO thromboplastin, your ISI will be 1. So more ISI is towards 1, better is the thromboplastin. So every pharmaceutical company, when they make a thromboplastin, they write ISI on it. So that is how you know what is the purity of the thromboplastin which is used by that company. So on the basis of this, we calculate INR. So if you look at this, in this, let us say the control was 10 seconds. And in this, if I say the control was 12 seconds, okay. So let's say the control was 13 seconds, okay. So if you take the INR here, so it is 12 by 10. Let us presume that they used human brain. So INR was 1.2. So here, 15 by 12 raised to the power of 1, it is also 1.2. So you can see here that the INR in both the cases, even though it is from different lab, came out to be similar. So this was what was called as INR. So they said till the time your INR becomes more than 2, you don't need to change the drugs. So that is why we always report PT as INR. Now, when will your PT get prolonged? PT will get prolonged whenever you have deficiency of these factors, okay? So whenever we have deficiency of factor 7, and common factor 10, 5, 2, 1. Common factor follow the law of half. That is, what is the half of 10? 5. What is the half of 5? Can I write 2? And what is the half of 2? 1. So 10, 5, 2, 1 is actually your extrinsic and common pathway, and these are predominantly affected when your PT is low. Okay. Now, factor 7 deficiency is very, very rare. Okay, so what is more common is drugs. So, especially vitamin K antagonists like warfarin. So, warfarin basically antagonizes vitamin K dependent factors, which is 2, 7, 9, 10. So, out of this, the shortest half life is of factor 7, that is only 6 hours. That is why earliest to get prolonged in warfarin overdose is PT, because factor 7 has the shortest half-life. So can I say that if a patient is on warfarin, how should you monitor them? You should always monitor them by INR, because it is factor 7 that is go off first, and the life of factor 7 is only 6 hours. Okay. Now look at this. A patient has prolonged PT, but APTT is normal. So what is the deficiency most commonly? So that means normal APTT means your common factor. So APTT measures intrinsic and common factors. So intrinsic factors are 12, 11, 9 and 8. Common factors are 10, 5, 2 and 1. So that means if PT is only prolonged, that means only 7 is abnormal, because common factors are normal. So 10, 5, 2, 1 to normal, and that is why the APTT is normal. That is why if the patient has prolonged PT, most commonly he is having deficiency of factor 7, and probably he is having warfarin overdose. Okay. So that's what you have to remember. Now somebody says, which are the factors which are identified by PT? So do not forget, it has to be 7, 10, 5, 2 and 1. All these factors are tested by PT. So these are the common points that you should know in PT and INR, guys. I'm sure you understood this, and that is why we always report PT as INR. That's all for today, guys. Bye-bye.